I'm Anne. I'm the nursing manager here in 3B3 as well.
Nice to meet you.
Hi, my name is CHUN. Is nursing educator from ED.
Nice to meet you.
Okay. Please take a seat.
Okay.
I hope the trip was okay. Yeah. So just to start off, would you like to tell us a bit about yourself?
Okay, I think you have already know my name. My name is Wang. I came from China. In China, I'm a registered nurse. I work in general hospital for over 10 years. 5 years working in surgical ward and 5 years in medical ward. After the 10 years working experience, I think I want to change my life, so I choose travel to Australia. I love this country. I decided to study in Australia and get the degree, and I want to find a job in Australia.
Yeah, okay. Why do you want to be a nurse?
I like this job because I think a nursing job can offer a potential to save people's life, and also it can give me a deep feeling of satisfaction. And also, I think I have 3 years study in China and 2 years study in Australia. Have 10 years working experience, and also I have 2 years working experience. I work in nursing home in Australia, so all of things give me strong confidence to find job in Australia.
Okay. So each of us are going to ask you a main question.
Yeah.
At any time, let us know if you'd like to skip that question, and we'll come back to it at the end.
Okay.
And if you haven't heard it, we can repeat it anytime. Just ask us.
Okay, thank you.
Okay.
Yeah.
Yep. And just breathe a little bit. We can tell you're just a
Yeah.
little bit nervous,
Okay.
but that's fine. We won't bite.
Okay, thank you.
Yeah. Okay. So as a registered nurse, we're always faced with various decision-making situations. So a hypothetical situation, you would have, more than 4 patients at a time. Let's say you have 4 patients. One of those patients, their oral medications are due. The next patient requires an indwelling catheter for urinary retention. Another one of your patients has a very low blood oxygen saturation. And the 4th patient is being verbally abusive to other patients on the ward. Can you tell me how you would prioritize the care of those patients?
Okay. I think if I look after the 4 patients, the patient who have the low blood oxygen saturation, that patient, I will deal with this patient first with priority, because this patient is in a life-threatening situation. I will do the oxygen saturation test first, because I want to make sure the result is correct result. If the result is really low, I think I need to do ABCD assessment for this patient. That means A is airway, B is breathing, C is circulation, D is disability. After that, I need to give the patient adequate oxygen, and then I will place the patient in the correct position, such like a semi-flower position. This position can decrease the press on the patient's chest, also can decrease the press on the diaphragm. And the other important thing, I need immediately inform the doctor, let them know, and let them do the assessment with the patient. During the doctor do the assessment with the patient, I think I can use this time to deal with the other patient who have the urine retention. I can maybe just spend 3 or 5 minutes and then insert the indwelling catheter for this patient to relieve this situation. When I go pass through the patient who abuse against the other patient, I think I just tell them keep quiet, because this is a quiet environment, and all of patients need quiet. So this problem in other place or solve this problem with other method. But if they still argue each other, because nursing job is working in the team, so I can tell the other staff that let them to help me stop them. And for the last patient who have the medication are due, I think I just tell them doctor, let them know if they have time, just give the patient new prescription. Yeah, I think as a nurse, if we have a high level skill, have a complete knowledge, if I have good time management, I think we can face and solve many difficult situations.
Okay, thank you. Okay. And the second question is, you are caring for a patient who has a diagnosis of a whooping cough. How will you protect yourself and others?
Whooping cough. I think whooping cough is a contagious disease. It can pass easily from one person to the other person. It is spread by contact airborne discharge from the mucous membranes of the infected patients. So the first thing the nurse need to do is infection control. Maybe let the patient live in a single room, single bed. That's one thing. The other thing, as a nurse should concern about is practice precaution to reduce the infection, such as washing hands regularly, wear mask, disinfecting, or get the good ventilation. This thing is important. Last thing I think important is we should encourage all the staff who look after this patient get immunization. That's important because immunization can help them protect themselves against infection. So I think these things I need to do.
Yes, great.
Okay, so this is your last question. I have a scenario for you. For example, you are caring for a patient who refuses all treatment. What action will you take on that?
Okay. I think if the patient refuse all the treatment, I think as a nurse, first thing we should do, we need to know what reasons contribute to this patient refuse all the treatment. If the patient have the verbal ability, if the patient have the clear thinking, maybe the patient can't understand what the need for the medication, or maybe they don't recognize what will be providing for them. So as a nurse, the effective communication is very important. We can talking with the patient. We can explain very clearly. We need to pay more attention to the patient. Maybe we can use non-verbal language, body language, just like have good eye contact with patient, touching the patient's shoulder, use the soft voice, talking with them, listen them as they explain why they refuse to all the treatment. The other thing is, if the patient is a child, I think we also need to explain clearly to them. The other method we should use is maybe give them a rewarding method. That means if they accept the treatment, we can give them a gift or sweet. We can use this method. If they continue to refuse the treatment, maybe we can talk with the parent, let them to help us.
Another thing, for example, the patient that you have has mental illness and she's refusing her medication. What will you do?
This I think this situation may be a little bit hard because if the patient have dementia, they can't understand what we are seeing. They can't understand what is the medication for, so it's a little bit hard. But they still need to take the medication. Maybe we can use some other method, just like put the medication in the meal, then feeding them with meal together, or put it in the juice. Then they can. The taste is better. There's good taste. Maybe they can take it very easily.
Okay, so that's it.
Great. Okay, so are there any questions you'd like to ask us?
I think no at the moment.
You're good? Okay. Anything you'd like to add?
No.
No? Okay, great. So we'll get back to you in at least a week or so.
Okay.
Thank you so much for your time.
Thank you, Yomaydin.